Can your body reject an implant or mesh? This is something that I see discussed really quite frequently on patient forums, and I've even had patients ask in my clinic. So let's discuss what it actually means to reject something. So the word rejection really comes from transplantation. Let's say you're having a liver transplant or a heart transplant. So that organ came from another human. Your body can reject it unless you're put on certain different types of medications that prevent that rejection. There's also a lot of immunology involved in this where not every patient is compatible with every patient, but that is for a different discussion. But during this rejection episode, your body actually attacks that organ. It starts to mount an immune response, an inflammatory response to this organ to the point where the organ can actually die. So that is rejection. So no, your body does not reject an implant. It's an inert object. It's not alive. It's just sitting there. But I think that it gets a little bit confusing is when patients have complications. So let's talk about why an implant might fail, which is not a rejection, but it could fail. It might be something like an infection or a fluid collection known as a seroma, or maybe a wound healing issue where the wound never closes and the implant's exposed, which makes someone need to have their implant removed. So I would characterize those as implant failures, but they're not rejection. Now, this can get a little bit confusing when patients are having ADM, which is acellular dermal matrix. Acellular dermal matrix is human cadaver skin that is sometimes used in breast reconstruction, and it can be put around an implant or around a tissue expander for different reasons. Your body still doesn't reject it because it's been decellularized. All of the cells have been removed, so your body no longer sees this thing as having come from a human. It basically sees it the same way that it would see an implant. So while we want that ADM to incorporate into your own tissue, to really mend and meld with your overlying mastectomy flaps, even if that doesn't happen, if that melding doesn't occur, it's still not a rejection. It's just, once again, a lack of incorporation or a failure, but not a rejection. So in conclusion, your body does not reject implants, mesh, ADM, but there's many things that can lead to failures of those devices. Does that make sense? Let me know below.